Every 40 seconds, somewhere on this planet, someone has a stroke. Before you even finish reading this sentence, another brain has already been hit. Every year, stroke kills nearly 6 million people worldwide, ranks as the second leading cause of death, and is the #1 cause of permanent disability. But there is something that almost nobody explains clearly enough. In many cases, the brain sends warning signals hours or even days before the major stroke happens. You just need to know how to recognize them. A stroke is not simply everything was fine and suddenly the person collapsed. In most cases, it is the final result of blood vessels that have been deteriorating for years. And if something is predictable, it is at least partially preventable. That is the key point. When we talk about stroke, we are actually talking about two different events. The first is hemorrhagic stroke, when a blood vessel bursts and bleeding occurs in the brain. The second is ischemic stroke, when an artery becomes blocked and blood stops reaching part of the brain. About 85% of strokes are ischemic. That is the type we need to focus on the most. To understand why every minute matters, you need to understand how demanding your brain actually is. It weighs about 1.4 kilograms, which is only around 2% of your body weight. Yet it consumes approximately 20% of all the oxygen you breathe and about 25% of the glucose circulating in your blood. Your brain is a control center that never turns off. It needs a constant fuel supply. If that supply is interrupted for even a few minutes, brain cells begin to die, and that damage cannot be reversed. That is why doctors say stroke is a race against time. It is literally a race to save brain tissue before it is lost forever. What most people do not realize is this. For a brain artery to suddenly become blocked, the process usually took years to develop. The vessel walls were slowly being damaged. Plaques were forming. Small clots began to appear. The opening of the artery was getting tighter and tighter. It is not an explosion out of nowhere. It is the final stage of a long, silent process. And along that path, the body usually sends warning signs. The problem is that nobody taught you how to recognize them. In medicine, these early warning episodes are called TIAs, transient ischemic attacks. Transient means temporary. It comes and it goes. But temporary does not mean harmless. Now imagine the main artery in your neck, called the carotid artery. It carries blood from your heart up to your brain. Over the years, especially if there is high blood pressure, elevated blood sugar, poorly controlled cholesterol, or smoking, a fatty plaque begins to form on the inner wall of that artery. This plaque does not appear overnight. It grows slowly. The opening of the vessel becomes narrower. Blood still flows, but with increasing difficulty. At some point, something happens. The already narrowed artery may go into a brief spasm, or a fragment of plaque may break off. A tiny clot may form right there. Blood flow to a specific area of the brain drops sharply, sometimes for seconds, sometimes for a few minutes. That part of the brain essentially blacks out temporarily. You notice a symptom. It could be difficulty speaking. It could be numbness on one side of your body. It could be temporary vision loss in one eye. Then the spasm relaxes or the clot moves away. Blood flow returns. The symptom disappears. And you think, it must have been nothing. But it was not nothing. Research shows that a TIA often occurs within the 72 hours before a major ischemic stroke. Those 72 hours are a critical window. It is the moment when disaster can still be prevented. The problem is that most people ignore this window because the episode was short and then it went away. These events usually last between 30 seconds and 10 minutes. That is exactly why they slip through unnoticed. You may be in your kitchen, in the shower, or getting out of your car. By the time you stop to think about what happened, everything feels normal again. But each of those episodes is your brain sending a clear message. I am in serious danger. The first major warning sign is temporary loss of vision in one eye. You get out of bed or start walking through your house, and suddenly one eye goes dark. It may feel as if someone pulled down a black curtain in front of that eye, or as if the lens were covered with thick gray fog. You blink a few times. Maybe you rub the eye. Within seconds, or at most a minute, your vision returns to normal. And then you think, I stood up too fast. Or, I've been looking at screens too long. Most of the time, this is not eye strain. What is actually happening is that a tiny clot or a small fragment of plaque has broken off from the wall of the carotid artery, traveled upward in the bloodstream, and temporarily blocked the artery that supplies the eye. The artery to your eye is not an isolated vessel. It is a direct branch of the internal carotid artery, the same artery that feeds your brain. When that small clot lodges there, blood cannot reach the retina, the light-sensitive tissue responsible for forming images. Without blood, the retina essentially shuts down. When the clot moves away and blood flow returns, vision comes back, and you feel relieved. But here is the critical point. That exact same clot could have traveled just 2 millimeters to the side and blocked a major brain artery. Instead of 1 minute of darkness in one eye, you could be facing paralysis, loss of speech, or death. This phenomenon has a classic Latin name, amaurosis fugax, which literally means fleeting blindness. For neurologists, this description is treated like a fire alarm. When a patient reports such an episode, urgent evaluation is required, because the risk of a major stroke in the following hours is real. Hospital records show a troubling pattern. Many people ignore 2 or 3 temporary vision loss episodes, and the next event is the full-blown stroke. The second major warning sign is sudden numbness or tingling on just one side of the body. The medical term is paresthesia, but you can think of it as your skin suddenly feeling off. It may affect an entire arm, just the hand, half of the face, or even one whole side of the body. The sensation may feel like pins and needles, like that body part is filled with cotton, or as if it has turned into rubber. The key detail is this: it comes out of nowhere. You are sitting, walking, or talking normally. You did not change position. You did not sleep on your arm. You did not hit anything. The sensation appears, lasts a few minutes, and then disappears completely. Many people confuse this with the feeling of sleeping on your arm and compressing a nerve. But that is different. In that case, the problem is local to the nerve, and once you change position, circulation returns, and the sensation quickly improves. In a TIA, the problem is not in the arm or the leg. It is in the brain. There is a specific area in the brain responsible for mapping sensation from each part of your body. When blood flow to that area drops temporarily, the brain switches off that region for a few minutes. And here is something crucial. Stroke symptoms are usually one-sided. That is because each brain hemisphere controls the opposite side of the body. If the left side of the brain loses blood flow, symptoms appear on the right side of the body, and vice versa. When both hands go numb evenly and symmetrically, that more often points to cervical spine issues rather than a vascular event. But sudden numbness on one side only, appearing without explanation and disappearing after a few minutes, is a strong reason for urgent evaluation. Ignoring that kind of episode is like ignoring the first warning of an electrical system malfunction. It may not burn the house down at that moment, but the risk is rising. The third major warning sign is sudden loss of coordination, what many people describe as walking like they are drunk, even without drinking anything. You are on a flat, familiar surface. Suddenly, your foot lands in the wrong place. Your leg feels weak or unstable. You stagger slightly toward a wall, or a strong spinning sensation hits you out of nowhere, forcing you to grab onto something for support. You did not change position abruptly. You did not turn your head quickly. You did not just stand up from bed. It simply happened. The part of the brain responsible for balance and fine motor coordination is the cerebellum. It sits low in the back of your skull, like a small auxiliary brain. Its role is to constantly calculate where your body is in space and adjust the strength and precision of your movements, known as the vertebrobasilar system. If blood flow in those arteries drops sharply, even for a few seconds, the cerebellum temporarily glitches. That is when imbalance, veering sideways while walking, or sudden intense dizziness appear. In clinical practice, there is a common pattern. People blame these episodes on fatigue, bad shoes, low blood pressure, or just a dizzy spell. Only later do they discover those were cerebellar transient ischemic attacks. Benign dizziness usually has a clear trigger, rolling over in bed, turning the head quickly, or a known inner ear condition. But spontaneous, intense dizziness combined with difficulty walking in a straight line should always be treated as a possible TIA until a doctor rules out a vascular cause. When the cerebellum is affected, the body loses fine control. And that is not something that should ever be ignored. When I explain this to my patients, I always say the following. The cerebellum does not warn by shouting, it warns by malfunctioning. If the interruption in blood flow is brief, you have a cerebellar TIA. If it lasts longer, you may have a cerebellar infarction, and that is not something minor. An infarction in this region can permanently affect your ability to walk, maintain balance, and coordinate simple movements. In more severe cases, when the brainstem is also involved, breathing can be affected and there can even be a risk of death due to brain swelling. There is a detail that almost nobody talks about. Many people who later suffer a posterior circulation stroke report having had 1 or 2 episodes of intense dizziness days before. They ignored it. They assumed it was labyrinthitis, fatigue, stress. Then the major event happened. I need you to understand something clearly. Common dizziness usually has a trigger. You turn your head and the room spins. You stand up quickly and your vision darkens for a few seconds. Vascular dizziness, on the other hand, appears without invitation, without obvious explanation, and often comes with real instability while walking. If you cannot walk in a straight line, if you feel pulled to one side, if you need support to avoid falling, this should not be treated as trivial. Another important point is that the arteries supplying the cerebellum run through the back of the neck. In some situations, especially in younger individuals, a small tear inside the vertebral artery can form a clot. Sometimes this begins only with unusual pain in the back of the neck, followed by unexpected dizziness. It is not common, but it happens, and when it does, early diagnosis makes all the difference. I tell my patients, if dizziness is intense, unexpected, and accompanied by real coordination difficulty, treat it as an emergency until proven otherwise. Do not drive. Do not wait for it to repeat. Do not self-medicate assuming it will resolve. The brain sends signals before collapse. The problem is that those signals are quiet and brief, and precisely because of that, they are ignored. Now I want to talk about a sign that often causes more alarm, but is also frequently minimized when it lasts only a short time: sudden speech disturbance. I need to clarify something first. Occasionally forgetting a word, mixing up a name, or having something on the tip of your tongue is not a stroke sign. That happens when we are tired, stressed, or distracted. What concerns me as a physician is something very different. It is when speech changes abruptly, noticeably, and strangely, even to you. You know what you want to say, but the words do not come out properly. They sound slurred, chopped, or stuck. Or you may speak fluently, but what comes out makes no sense. Sometimes the person notices something is wrong. Other times someone nearby notices first. This happens because specific areas in the brain are responsible for language. Broca's area helps form words and coordinate the muscles of speech. When it loses blood flow, you understand everything but cannot articulate properly. Wernicke's area is responsible for understanding language and organizing meaningful sentences. When it is affected, a person may speak a lot, but without coherence, and may not understand what is being said to them. If any of these speech changes appear suddenly and then fade after a few minutes, that is highly suggestive of a transient ischemic attack. And here is the common mistake. Because speech returned to normal, the person assumes it was just fatigue. But the brain does not malfunction like that without a reason. When there is temporary interruption of blood flow in these areas, it means the artery is unstable. And an unstable artery carries real risk of complete blockage in the coming hours or days. I have followed patients who described a brief episode of slurred speech during breakfast. They did not seek help. 2 days later, they suffered a major stroke with permanent language loss. Sudden speech disturbance should never be ignored, even if it lasts only a few minutes. Now I want to talk about a warning sign that surprises many people because it does not seem directly connected to the brain. It is the combination of certain skin changes, such as vitiligo, along with new, unusually intense headaches that differ from your usual pattern. Vitiligo is an autoimmune condition, meaning the immune system begins attacking the body's own cells, in this case the pigment-producing cells in the skin. When the immune system becomes dysregulated in one area, it often does not stop there. It can also silently affect the endothelium, the microscopic inner lining that coats every artery in the body. I often explain to my patients that the endothelium functions like an extremely smooth non-stick surface. When it is healthy, blood flows freely and nothing adheres to it. When it becomes inflamed or damaged, that smooth surface becomes rough. Cholesterol particles, platelets, and inflammatory proteins begin to stick. Over time, plaques form and vessels narrow. Vitiligo alone does not mean you will have a stroke. But if it is accompanied by new headaches, especially stronger or different from what you have experienced before, that deserves evaluation. Headache is a complex symptom. Often it is caused by muscle tension, cervical joint degeneration, or disc problems. However, when the headache changes pattern or appears along with other neurological signs such as dizziness, visual disturbance, or speech difficulty, we need to think more deeply. I always emphasize, do not treat headaches with painkillers for months without understanding the cause. Decoding the origin of the pain is essential in prevention. Now, there is a dangerous myth that must be addressed. Many people believe that if their cholesterol is normal, their stroke risk is controlled. That is not entirely true. Risk depends not only on what circulates in the blood, but on the internal condition of the vessel walls. Here is where the silent villains come in. The first is chronically elevated blood sugar. Even mildly elevated levels, as seen in prediabetes, are enough to damage the endothelium over years. Glucose needs insulin to enter cells. When insulin resistance develops, glucose remains in the bloodstream while endothelial cells become metabolically stressed. Weakened cells lose their ability to maintain a healthy vessel lining. Irregular areas form where LDL, low-density lipoprotein cholesterol, deposits more easily. This process begins years before someone receives a formal diabetes diagnosis. The second major vascular aggressor is smoking. Cigarette smoke contains thousands of chemicals that directly inflame vessel walls. Additionally, nicotine and carbon monoxide make blood thicker and increase clot formation tendency. When you combine inflamed vessel walls with more viscous blood, you create ideal conditions for a clot to form and block a brain artery. Statistically, smokers have 2 to 4 times the risk of ischemic stroke compared to non-smokers with similar cholesterol and blood pressure levels. Finally, we must talk about blood pressure. Chronic hypertension weakens vessels over time and accelerates plaque formation. It is strongly associated with hemorrhagic stroke when a vessel ruptures. However, there is an important nuance. Ischemic stroke often occurs not at peak blood pressure, but during a relative drop, especially during sleep. At night, blood pressure naturally falls about 15 to 20%. If an artery is already narrowed by plaque, that physiological drop can reduce blood flow enough to turn a partial blockage into a complete one. That is why some people go to bed feeling fine and wake up already experiencing stroke symptoms. It did not begin at that moment. It was the result of a long process that finally found the right conditions to manifest. Now we arrive at the most practical and honestly the most important part of this entire discussion. What should you do if you have already experienced one of these warning signs, even if it lasted only a few minutes? You need to understand this clearly. After a suspected TI, you have roughly 72 critical hours. That period is a golden window to prevent a major stroke. It is not time to panic, but it is also not time to wait. It is time to act intelligently. First point, do not remain completely alone after a suspicious episode. I always tell my patients, especially those who live alone, to inform someone they trust. If another episode occurs and you lose speech or movement, someone else must recognize it and call for help quickly. Second point, do not drive. Even if symptoms have passed, you do not know if another episode could happen while you are behind the wheel. Losing vision or strength for seconds at highway speed can be fatal for you and others. Third point, checking blood pressure is essential. If it is around 180 over 110 or higher, that qualifies as a hypertensive crisis and requires immediate medical attention. Do not wait to see if it improves. And I must strongly emphasize something serious. Never start aspirin or anticoagulants on your own after a suspicious event. There are 2 main types of stroke. If it is hemorrhagic, thinning the blood can worsen bleeding and accelerate deterioration. The only safe way to differentiate is through brain imaging, usually a CT scan in a hospital. While waiting for care, lie down in a comfortable position, preferably with legs slightly elevated to support circulation. Avoid very hot showers, alcohol, or smoking at that moment. Keep a written list of your regular medications, as this can save precious minutes in emergency care. And here is something many people misunderstand. If 72 hours pass without another episode, that does not mean the risk has disappeared. It means you were given a second chance, and you need to use it. Now I want to talk about something extremely practical. If you experienced any of those warning signs, even months ago, there are 3 tests you should seriously discuss with your doctor. Each one evaluates a different piece of the stroke puzzle. The first is a carotid Doppler ultrasound. This is not a simple structural scan. It shows both the anatomy of the artery and the blood flow within it. It can detect significant narrowing, identify areas where blood flow speeds up, suggesting a tight passage, and reveal unstable plaques that may release small clots. When narrowing exceeds approximately 70%, we call it hemodynamically significant stenosis. At that point, risk is no longer theoretical. It is no longer if a stroke may happen, but when, if nothing changes. In some cases, treatment may involve a procedure called carotid endarterectomy, where the plaque is surgically removed from the artery. It sounds dramatic, but today it is a relatively routine surgery that saves thousands of lives each year. The second test is glycated hemoglobin, also known as HbA1c. This test reflects your average blood sugar over the past 3 months. It cannot be manipulated by eating well for just 1 day before the test. It reveals whether glucose has been silently damaging your blood vessels. Values below 5.7% are considered normal. Between 5.7% and 6.4% indicate prediabetes. At 6.5% or higher, diabetes is typically diagnosed. And I emphasize, vascular damage begins before the official diagnosis. The third test is 24-hour Holter monitoring, a device you wear for a full day to continuously record your heart rhythm. This is crucial because dangerous arrhythmias like atrial fibrillation may appear only briefly and go unnoticed in a short 10-second electrocardiogram. In atrial fibrillation, blood can pool in the upper chambers of the heart and form clots. Those clots can travel to the brain and cause a cardioembolic stroke, which tends to be more severe. If atrial fibrillation is detected, properly prescribed anticoagulants can reduce stroke risk by 60 to 70%. That is not destiny. That is modifiable risk. I want to end this conversation by being very direct with you. Stroke is not a lightning bolt from a clear sky. In most cases, it is the predictable result of years of silent damage to blood vessels. The good news is that what builds slowly can also be slowed down and, to some extent, prevented. Prevention is not an abstract idea. It is extremely practical. It means keeping blood sugar under control before it becomes diabetes. It means managing high blood pressure in a balanced way, avoiding extremes. It means quitting smoking, even if it is difficult, because every smoke-free day reduces inflammation inside your vessels. It means investigating suspicious episodes, even if they lasted only a few minutes. It means not normalizing one-sided numbness, slurred speech, temporary blindness, or intense dizziness. It means understanding that 72 hours can separate a warning from a permanent disability. It also means recognizing that age matters. After 50, risk increases significantly. After 60, even more. But increased risk does not mean inevitability. It means increased vigilance, increased discipline. If you have experienced any of the 5 warning signs we discussed, do not ignore them. Write down what happened, describe it clearly, and bring it to your doctor. Ask about carotid Doppler ultrasound, glycated hemoglobin, and Holter monitoring if appropriate in your case. Do not wait for the next warning. The brain does not usually warn 3 times. It often warns once or twice. The third may be definitive. And remember, feeling fine does not mean your vessels are healthy. Vascular damage is silent for years. What protects you is not only what you feel, but what you measure and control. Preventing stroke is not living in fear. It is living with awareness. It is acting before collapse. If this explanation made a complex subject clearer, share it with someone who needs to understand it. Many people seek information only after damage has already occurred. If you learned something here, use it to have a better conversation with your doctor and make smarter decisions. Your brain health depends on small actions repeated every day.